صوتي يوصل؟ معن صوتي؟ سجا.
نعم دكتور الصوت واضح.
اوكي. تبقى جروب A ميسون.
نعم دكتور أنا جروب أي بس مو ميسون. صوتي ينسمع
اوكي شكرا. Okay, today we start a new lecture. Last lecture we talk about rest and rest seat, occlusal rest. Now we talk about how we prepare occlusal rest seat. The bears we needed are round bear and tapered cylindrical bear. This is round bear and this is the tapered cylindrical bears. First of all, you have to know something. Never create undercuts. Never create undercuts. And we talk about how we avoid creating undercuts. First of all, this is, for example, occlusal surface. We hold the turbine in a way that the bears are perpendicular to the occlusal surface. The bears are perpendicular to the occlusal surface, like this. First, pushing downward. Second step, pushing toward the mesial, toward the center, toward the centers. This bear is the same also. We can use it, it's round-ended bear. After we finish the form, we bring the taper one to cut from the margins to make the surface flared. Flared like this one. There is no undercuts. The outer border is wider than the base because we said it's like a triangle. Like a triangle, as you see, the base is very clearly visible. So the most important thing, avoid creating undercuts. Now, what we do, we are using round bear positioned above the enamel surface, then moved vertically into the enamel. This one, moved vertically into the enamel. After that, bears moved laterally. Laterally, it means toward the center of the tooth, because we say the base or the apex is toward the center. Then after that, upon removal of the bears, distinct overhang is present. As you see, once we finish the round bear, using round bear, we have undercuts. This is overhanged enamel. What we do now, we remove it by the second bear, tapered cylindrical bears. Why we use tapered cylindrical? Position above the enamel, move vertical into the enamel, moves laterally, and no overhang now is present. We remove all the overhangs. The outline of the occlusal rest seat established using round-ended tapered bear in high-speed handpiece. The same bear used to establish the correct depth of the preparation. After we finish the triangle, now we start creating or increasing the depth. The depth is in the center is more than the marginal side. This was for occlusal rest. Now we come to lingual rest, or we call it cingulum rest, which is prepared on the canine. This one, and this is more clear. As you see, this one. This is lingual or cingulum rest, because you know we have three types of rests. occlusal, lingual or cingulum, and incisal. Lingual rest or cingulum rest usually used on the canines, or call it cingulum rest because of well development of the cingulum. When canine is not available, the incisor may be used, the lateral one, lateral incisors. But it's preferable to use on the canine. The mesiodistal width, this one, mesial and distal, mesiodistal width is about 2.5 millimeters to 3 millimeters, while the labiolingual depth, the depth is about 2 millimeters and 1 millimeter apex toward the center, 1.5 millimeters. This is 1.5, this is 2 millimeters. It's very clear on this picture. The mesiodistal 2.5 to 3 millimeters, the buccolingual 2 millimeters. The apical depth is 1.5 millimeters. Like the previous receipt, never create enamel undercuts. In this preparation, we need cylindrical burr with the long axis of the tooth. Its axis to the long axis of the tooth. The tooth is like this. As you see, the burrs slightly tilted buccally to avoid overhanging of the enamel. Same on the base. Then after that, we bring an inverted burr. Inverted burr is a triangle, but the base toward the center to create a form like this. To create a form like this. Then we bring a flame shape or tapered burr to finish the borders. An alternative to cingulum rest or lingual rest is creating like a half moon shape or crease shape rest seat. In this case only we need inverted cone burrs. Inverted cone burrs to create the rest seat in the cingulum part. And these are the ideal rest seat. This is too high and this is too short. The canine has an anatomical form. We have to follow this form, not prepare on the flat surface and not go too deep in the cingulum. We have always should be in the middle of the tooth. Why? Because in the middle of the tooth we can create a triangular shape that the apex toward the center. Why? To allow the force directed, the occlusal force directed toward the central or to the long axis of the tooth. Some points or some features regarding the cingulum rest: placed on sound tooth or restoration, never used caries tooth or never placed in an area has caries, could not be placed on the amalgam restoration. On the composites, okay. On the amalgam restoration, avoided. Why? Because after continuous application of force to the amalgam, make the amalgam softer like a gel and can cause a property called creep. In last lecture, in your second stage, dental materials, you know what's creep. You take creep. If the cingulum is not prominent in the canal, is not prominent, and or we have a large pulp, use another tooth. Do not prepare on that tooth. Bonded raised seat, we talk about them, what's bonded. Or we can use onlay or crown. Or we can use onlay or crown. Because if the cingulum is not prominent, the force will not be directed toward the center. If the pulp is too large, because almost the canines and incisors have a large pulp, I mean, we easily get into the pulp. At that time, as possible, avoid that tooth. If you have to use that tooth, use onlay or crown. An important hint in case of cingulum rest, we didn't have this problem in the occlusal rest seat preparation, because in the occlusal rest we want to get occlusion. It's posterior, it's easier to get occlusion. But in case of anterior, as you see, if it's too high, the lingual cingulum rest or lingual rest, the opposite tooth will contact or close on the rest, which is discomfortable for the patient, cause premature contact, and avoid closure or occlusion on the posterior teeth. So before starting preparation, we have to get diagnostic cast to know the occlusion. On the diagnostic cast, we mark the rest seat position, then we copy this marked preparation on the tooth, on the natural tooth. We have to get about 0.5 to 2 millimeter clearance from the metal, this space of 1.5 to 2 millimeters to allow for the free movement of the mandible. We will check it by use of articulated models, like a diagnostic cast, as we said. We talk about this. Indications for cingulum rest or lingual rest: prominent cingulum, as we mentioned earlier. Good oral hygiene. This good oral hygiene is regarding all the rest preparations. If the patient does not have a good oral hygiene or don't care about his oral hygiene, it's better not to prepare the rest on the tooth. At that time, it's better to make crown and prepare the rest on the crown, because any person don't care about his oral hygiene will cause caries under the rests. Subsequently, as a result, the caries index should be low. If the patient has good oral hygiene, it means the caries index is low. We talk about this, we just repeat it because of the slide. The form is a spoon shape. نعم.
دكتور بالنسبة لللينجوال أو السنجلوم ريست مو لازم تكون بالإنامل، فإحنا عندنا الكناين يعني الكناين الأبر عن اللور يصير ثيك الإنامل ماله. فشون بالنسبة لللور يعني الكناين اللور كناين؟
مو هسه قبل شوي قلنا إذا مثلا وصلنا للبالب أو الدينتين بالبريباريشنات المحاضرات القادمة، إذا وصلنا للدينتين نسوي ريستوريشن. إذا عرفنا من نسوي البريباريشن نوصل للدينتين نسوي ريستوريشن، وبعدين نخلي الريست سيت بالريستوريشن بالحشوات. بس إذا عرفنا نوصل للبالب نسوي له إنلي أو كراون. عرفت شلون؟ يعني
تمام دكتور.
مثلا هذا هسه خلينا نرجع هايته تشوفه البريباريشن مو هالقد، مليمين مليم ونص الى مليمين تقريبا. مليمين، هاي المليمين مو هالقد. يعني اذا الثكنيس اقل ثكنيس اقل سمك للانامل اقل شيء والمفروض مليم او هو اكثر طبعا. بس اذا قلنا السن ديفلوبمنت مالته الجروث مالته مو بيرفكت هو مليم من الانامل ومليم من الدينتين. بس من نخلي داخل الدينتين نسوي له لو ريستوريشن لو كونتينيوس فولو اب. ليش الكونتينيوس فولو اب؟ حتى نسوي له توبيكال فلورايد ابلكيشن حتى نمنع الكيريس. بس هذا في حال ان المريض لازم يعتني بالتفريج مالته، يعني ما يصير لي فود ترابمنت او كيريس والتسوس جوا الريست. بس اذا عرفت ان بالبريباريشن راح اوصل للبلب ذاك الوقت، اذا قدرت اتحول على غير ريست اغير الريست او اتحول على غير سن او اسوي له انلي او كراون. تمام
تمام دكتور.
تمام. It's a spoon shape مثل ما قلنا. It's a spoon shape مثل الملعقة مثل الخاشوقة. Similar to occlusal rest, the apex toward the center. More difficult on the canine, slightly difficult, more difficult than occlusal, we say. Not is very difficult. Regarding when comparing to the occlusal rest seat, it's more difficult than occlusal rest seat because of the anatomy of the tooth. We have inclines in the canine on the lingual surface. We have to follow the incline and we have to cut only within enamel slightly. If we get into the dentine, we have to take care about the tooth. But if we made a crown, it's easily incorporated into the crown. يعني إذا سوينا له قفخ ذاك الوقت أسهل. Now we talk about incisal rest, the third one and the last rest. Incisal rest seats. From this picture مثل ما تشوفون هنا, the incisal rest will be displayed or appeared on the outer surface or on the labial surface. يعني المعدن يبين واضح هنا. فمعناته شنو؟ مو aesthetic. As much as possible avoid this rest. As much as possible try to avoid making this rest. Less desirable than lingual rest or occlusal rest. Prepared on sound teeth, especially the lower canines. هذا اللي قلنا عليه. إذا ما عندي sufficient enamel أتحول على غير rest أو على غير سن. If incisors are used, we have to make multiple rests. يعني هسه عندي الكناين الروت مالته كلش قوية، تتحمل ريست هنا وريست هنا. بس إذا ما عندي كناين انجبرت أسوي preparation على الانسايزرز، لازم مثلا أريد أخلي هنا 1، لازم 2 3 أو 4 multiple rests because of the surface area of the root of the incisors are less than the canine. Mainly used as indirect retainers. Mainly used as indirect or auxiliary rests, not main rests. Incisal rests are contraindicated in cast restorations. يعني شنو؟ قلنا مثل الأوكلوزال rest والlingual rest can be prepared on crown, but in case of incisal rest cannot be prepared on the crowns. Its mechanical property and aesthetic are inferior to the lingual rest. It's weaker. Why? Because the lingual rest or cingulum rest are near the center of rotation, near the center of the tooth, while this one at the apex. Now the dimensions. We have to leave a space about 1.5 millimeter from the outer margin of the tooth, then starting preparation. And the width is about 2.5 millimeters and the depth 1.5 millimeters. But the most important thing, not make rest seat preparation on the marginal or lateral part of the tooth. Leave a space about 1.5 millimeters like this, as you see. As you see, this is not prepared on the margin. We have to leave a space about 1.5 millimeter distance from the outer margin, then prepare our rest seat. We have to extend the rest seat to the facial side, to the labial side. Why? To act as like a locking device. Locking. حتى تشتغل مثل القفل. Prevent tipping of the tooth or tipping movement of the tooth. ليش؟ إذا هذا الجزء إذا لو فرضنا ما سوينا extension، يعني هذا الجزء ما موجود، بس هاي المنطقة موجودة من الريست، شو راح يصير عندي؟ من during occlusal force أثناء الأكل، هذا التيب مثل ما تشوفون البيس toward the center، شو راح يصير عندي؟ يدفع السن لقدام anterior pushing of the tooth, which will cause later, after few months or few years, mobility in this tooth. So what we have to do, we have to extend the rest or rest seat preparation to the labial surface to lock, to act as a lock, مثل القفل تشتغل, to avoid pushing the tooth. At that time, the force directed to the center vertically. After finishing rest seat, we have to slightly cut from the enamel, shallow enamel preparation, this part. Why? To accommodate for the minor connectors. حتى مكان الماينر كونكتور راح تجي هنا مكان الماينر connectors to prevent discomfort for the tongue. راح شوية اخذ من اللينجوال سيرفيس حتى اخلي مجال او سبيس للماينر كونكتورز. اذا لو فرضنا ما سوينا هاي البريباريشن ايش راح يصير عندي؟ من اجيب الماينر كونكتور مالته ايش راح يصير؟ المريض يحس بثخن اكثر. The thickness will be increased. To avoid this discomfortance for the patient, we slightly cut from the enamel, cutting from the enamel to allow space for the minor connectors. This is the preparation, this is the form. It's easiest one to be prepared. It's just require flame-shaped bear. Very easy to prepare, but as much as you can avoid this rest seat preparation. We have some situation, we have to make rest on the entire incisors, on the all incisors. Why? Because tooth morphology don't allow or does not allow or permit other designs. The tooth morphology is such a way that I cannot prepare the rest seat on one tooth. I have to prepare on multiple teeth for the mechanical forces to be directed toward the center of all teeth. When the incisal edge is completely lost, second point, I don't have an incisal edge, meaning the dentine, which is mostly, you can mostly see in all patients or in patients with bruxism, the incisal edge or enamel will be lost and the dentine appeared through the tooth. At that time, we have to make multiple rest seat preparation to distribute the force over more teeth. Third point, when we need more stability, for example, in this case, we don't have posterior teeth, and two teeth cannot support these dentures. We prepare multiple rest seats. When we do these preparations, guidance is required for placement of restorations. We have to make restoration on the tooth or teeth before starting this rest seat preparation. This is from the lingual side. This is what's from labial side, as you see. From lingual side, all of the rest should be connected together by plate of metal. This is a repetition, not in position. Okay, if you have any question. I will wait for a few minutes because we finished the lecture. If you have any question, you can ask. Okay, you don't have any question. Thank you for your listening. We will end our lectures for today. Thank you very much and goodbye.
Doctor, can I ask a question?
Okay. نعم هند آيات.
Yes, you said something regarding the incisal type. This type cannot make rest on crown.
هند صوتش بصدى.
Doctor, you said that the incisal type cannot make a rest on the crown, right?
Yes.
So regarding all the other types, you can make rest on natural teeth and crown. Only this one that we cannot make on crown, we just make on natural teeth?
Yes.
Okay, thank you.
Okay. Why? Because we don't have sufficient space. Sorry, this one. I cannot make a crown then rest because I don't have sufficient distance. I don't have space to create both crown and rest. For this reason.
Thank you, Doctor.
Welcome.
دكتور السلام عليكم.
عليكم السلام ورحمة الله.
دكتور بنمزح مع الكلاسبات إنه ما كملناها، لازم يوم 28 نسلمها يعني. فإذا ما صار يعني يصير بعدها عادي.
أتوقع هيك إنه صار هاي بكارنتين وما أعرف شنو فكل شيء تغير.
دكتور والكلاسبات تسوي حول
لا بس عيد لي صوتك يتقطع. محمود.
عفوا دكتور. نعم دكتور هسه تسمعني؟
ايه هسه اسمعك.
دكتور بالنسبة للكلاسبات يعني يسوي بس حول الاباتمنت تيث يعني 4 كلاسبات؟
ايه نعم
4 نسوي يعني.
ايه 4 تسوون هسه.
ايه تمام دكتور.
اذا صار عندنا مجال وهاي الظروف تغيرت ذاك الوقت نحكي غير شيء، بس حاليا هسه 4.
تمام دكتور، شكرا جزيلا لك.
يا